Welcome to the PCOS Society of India. As a founder president of the organization, I welcome you all to be part of our organization, which is a multidisciplinary organization consisting of specialists and experts from various fields of medicine who look after women with PCOS and even young girls and even children. Our organization is focused on education of the doctors and education of our patients. With the recent Vijayata program, which we have created through the support of Philips India, we are reaching out to women all over the country. And I request all of you to be part of this program, to take this complete agenda nationally and to educate our women on how they can prevent complications for themselves in future. I also request you to become our members, because that is what is going to help you in updating your skills in this field, which is really a very growing area of treating women and preventing problems in future. Thank you very much, all of you who have been with us, and I look forward to interacting with you in many, many more programs to come.
Good afternoon, everyone. I, Dr. Priyanka, on behalf of PCOS Society of India and Vijayata Project, I welcome you all for today's panel discussion, which is on how to control PCOS in adolescents. So this project is brought to you by Vijayata. Vijayata is a project which has been initiated by the PCOS Society of India with the support of Philips, in which we are trying to address a very important health crisis called as PCOS. So before we begin with the panel discussion, let us start by understanding what is PCOS. PCOS is a short form for polycystic ovarian syndrome. It is becoming very common, with 1 in every 5 Indian women suffering from PCOS. It can occur at any age after the onset of menstruation. However, the most commonly diagnosed age is between the age of 20 and 30 years. It is also the most frequently observed cause of female infertility. So coming back to today's panel discussion, we have with us Dr. Chandrika Anand, who is going to be moderating today's session. Ma'am, I welcome you for today's panel discussion. Ma'am is an MD in D&D. She is a director of PCOS Center. She is a chief consultant at Fortis Hospitals in Bangalore. She is a South Zone coordinator of Endocrine Committee. She is a managing committee member of the PCOS Society of India. She has won 8 gold medals during her MBBS and MD period. Her areas of interest includes PCOS and high-risk pregnancy. Let us all welcome today's panelists. We have with us Dr. Sushma Rai. Ma'am is a consultant pediatric endocrinologist based in Bangalore. She is a member of Indian Society of Pediatric and Adolescent Endocrinology, Asia Pacific Pediatric Endocrine Society. Her special interest lies in pubertal disorders, including adolescent PCOS. Next, we have Dr. Vinay Choudhary. He's a physiotherapist, and he has completed his post-graduation in community-based rehabilitation from Padma Shri Institute of Physiotherapy, Bangalore. He has decades of experience in human performance and injuries prevention treatment using therapeutic and holistic approaches. He's currently working at Fit Good Sports Performance and Physiotherapy Center, also in Saraswati Clinic. He has worked with national and international athletes as a team physiotherapist for Hockey India League and World Series Hockey. Next, we have with us Ms. Ramya R. She's a psychologist based in Bangalore. She has completed a master's in psychosocial rehabilitation with 11 years of experience in mental health field. She's currently working as a counseling psychologist with Dr. Chandrika Anand ma'am in PCOD Center, Dharma Search Clinic, SEC Automotive Private Limited, and Malike Child Care Center. She has expertise in cognitive behavior therapy, group therapy, supportive psychotherapy, family assessment, and various other mental health therapies. Next, we have Ms. Priyanka, who has completed a MSc in clinical nutrition and dietetics. She's a specialized dietitian with over 6 years of experience with diverse clientele to deliver an effective and detailed plan to meet their individual goals. She's skilled at managing client relations and keeping in track to make adjustments when needed. So I welcome all the panelists once again, and I will request Dr. Chandrika Anand ma'am to take over from here. Ma'am, over to you.
Yeah. Thanks, Priyanka, and thanks to PCOS Society of India and Dr. Durusha for giving us this wonderful opportunity to reach out to a lot of adolescent girls, college students, and parents of the girls who are suffering or who could be suffering with the PCOS. And I thank all my panelists for taking out their time on the weekend and sharing their experience and their expert opinions regarding the management of these PCOS in adolescents. So adolescence is a tender age. The WHO defines that as 10 to 19 years. And adolescent girls, the issues are becoming increasingly day by day. And PCOS is increasing in adolescents. PCOS-like symptoms are increasing in adolescents. So we have a variety of patients, patients who are coming with they go to the some scanning center for a pain abdomen and they see there is a PCOS in the scan, or some girls they are overweight and they go to an endocrine, then they are diagnosed with PCOS. Some girls end up with having excess of unwanted hair or hirsutism, and then they go to the dermatologist or the cosmetologist. So generally, and there are a lot of pediatricians who are seeing that the young girls are putting on too much of weight and they're not able to lose weight and they are developing symptoms of PCOS. So, and almost 1 in 5 teenager in India is suffering from PCOS. So this PCOS can have a lot of complications. It can be cosmetological complications, reproductive complications or metabolic complications, and mental health issues. So today we'll have a discussion, simple discussion based on our experience. I'll be just taking some questions from all of you panelists, and they'll share their experience. Now, let us come to Dr. Sushma first. I think she's a pediatric endocrinologist. She is doing extensive work in juvenile diabetes and pubertal disorders and PCOS. We have worked together for many years. So, Sushma, how often do you see these young girls with irregular periods in your practice, and how common do you think is adolescent PCOS?
Thank you so much. Thank you, ma'am, for the question and for the introduction to the PCOS. And I think we welcome all our audience and delegates who have joined us this afternoon. So I think it's a very great initiative which has been taken up by the PCOS Society of India. And if there is some ongoing education like this, I'm sure all of our audience are going to benefit from it. So starting with the basics, how common is it? Because if it reaches a target audience, I think half our job is done. So definitely, as Madam already pointed out, the presentation of these of this condition is quite diverse, and they may visit different specialties because it is a multi-speciality symptom-based disorder. But I'm sure commonly most of our young girls are concerned with cosmetic issues related to the skin manifestations and the menstrual irregularity, of course. So the menstrual irregularity again is quite a common thing which we see in young adolescents who have just about attained their period. So the main diagnostic dilemma at this situation is whether to label them as normally, having aberrant menses during the period of first period of menarche, as we call it, or are we looking at a deeper pathology like PCOS? So the menstrual irregularity per se is quite common. And also more so, I think, because of the various lifestyle changes that we see. So I think PCOS, as we already have mentioned, is somewhere common between 5 to 10 to 20%, depending on weight. Again, irregularity may not be PCOS, but it is definitely important to get evaluated by the specialist and make sure that we don't miss out on a pathological condition. PCOS. So the evaluation is what is more important, I think. So I think I've answered about the common symptom.
Correct.
And how to diagnose is another. So the first challenge for us as pediatricians or gynecologists when a young adolescent comes with the menstrual irregularity is to know whether it is a physiological or a natural process around the time of first period when they can have irregular periods. And of course, once we kind of screen them for either by history, examination, or sometimes if required some lab test, then of course we need to, assure them that it was normal if the lab tests are normal or the whole evaluation is normal. and then look at the secondary causes, which can be PCOS and another host of varied other conditions.
Correct.
So that's how I would.
So I think as Dr. Sushma rightly pointed out, so the PCOS prevalence is almost 20%. That is 1 in 5 young adolescents. And the basic dilemma is, so many girls, teenager girls will have a irregular cycle once in a while. So is all of them PCOS is the big question. That is when the diagnostic criteria for PCOS comes. So generally the guidelines, international guidelines and all over the world, we agree that the first 2 years after the girl matures or attains her first period, the first 2 years it takes for the brain and the hypothalamus and the pituitary thyroid glands to mature, and it creates a rhythm of the regular cycle. So the first 2 years we give time for the whole hypothalamo-pituitary axis, ovarian axis to mature. So first 2 years, if your daughter or if yourself or if your daughter or anyone suffering from heavy period, then you need to come for a treatment. Okay, so the first 2 years, the irregularity should not really bother you so much. Basically, if the girl is bleeding very heavily, but then you have to come to the doctor. That is one thing. And also in the first 2 years, if the girl is getting only period once or twice a year, more once in 3 months, that could be a sign that, okay, now this girl could be going for PCOS. So these are all the symptoms, but not exactly PCOS. So in future, we're going to, keep an eye on that girl and follow her menstrual cycle. So any girls who have matured just then, first 2 years, we give them something called a menstrual calendar. We tell the mothers, because the girls are pretty young. The average age in India is around 12.3 years, and decade by decade the year is reducing thanks to the obesity. I'm sure Dr. Sushma will agree on that. So we give them a menstrual calendar. We tell them, okay, you mark and come, and then we follow these first 2 years. So after the first 2 years, if the girl is still having irregular cycle, something like 21 to 40 days, you need to get the periods. The duration is either once in 21 to 40 days, the girl has to get the period. If it goes beyond the 40 days, if it comes earlier than the 21 days, that could be a significant symptom for PCOS for us to diagnose, along with the other signs, which I think Dr. Sushma will enumerate. So what are the other signs you're looking at for Sushma? Like the skin signs, as you told, the cosmetology, the girls will end up in the dermatological clinic. So what are the other signs and symptoms we are looking at, Sushma?
Yeah, so as we have already mentioned, so when we have to diagnose, we look at certain criteria. So the first and most important is definitely a menstrual irregularity. The other thing we're looking at is the production of hormones, or rather let's call it abnormal result in some clinical features, or we may have to do a lab test. So what clinical features we are looking at? It is the production probably of the male hormone is slightly above normal range in that age for the girl. So these can cause symptoms like acne, or they can have some unwanted facial hair or hair which is more than the usual accepted norm. And definitely sometimes because of obesity per se, which is linked with the PCOS, you can look at skin changes, which is usually at the back of the neck, we say, where there is darkening and thickening of the skin. And because of all these features, sometimes patients go primarily to the dermatologist and then get referred back to us. So this is what we call as increase in the signs of male hormone or androgen body. So clinically look at of these features. And of course, I think in a little older age, they also look at loss of hair. So we call it as alopecia. So these are some of the signs which suggest it is abnormal with menstrual irregularity. So this is two important criteria for us to diagnose as PCOS. Then of course we look at other features which are also a spectrum of the PCOS or the metabolic syndrome. So a young girl who is gaining weight, overweight, and suppose you have a strong family history of diabetes, cholesterol, or lipids, what we say. So these are also important, and some other small risk factors, like if a girl was born premature, was born low birth weight, who had some early signs of puberty. So these are all risk factors for PCOS. So I think we have to put everything together and then decide how much of lab tests we need to do for these children.
Correct. Yeah, I totally agree. So we don't want to overdiagnose PCOS and cause stress to the girl. as a label the girl as a PCOS patient and undue stress to the parents also, because PCOS is an enduring diagnosis in the sense it is not a diagnosis which just it is not like a viral fever or a dengue fever or a malaria or something. It is like a diabetes or hypertension. You get labeled for that and that stays with you for many years to come. So before we overdiagnose the PCOS young girls coming with irregular cycles, our diagnostic criteria are very specific. As Dr. Sushma rightly told, we are looking at excess androgen hormone or the male hormone signs, that is unwanted hair on the upper lips, chin, sideburns, anterior chest, posterior chest, abdomen in front, that is navel, and then back, lower back, thighs, upper arm. So we look for, when a young girl comes with a irregular cycle, we look for unwanted hair on the face. See, this hirsutism or the unwanted excess male pattern hair is the strongest predictor of hyperandrogenism. It is present in almost 70 to 80% of women with PCOS. Severe acne, adolescent acne or puberty acne is very common. It need not be PCOS and it does not reflect hyperandrogenism very commonly. But very severe persisting acne, which is causing pus and leaving scars and which is resistant to most of the treatments, can be because of PCOS. So the dermatologists generally treat the acne like a pubertal acne because it's not a very strong predictor. But then eventually, if the acne is too much, then we'll have to think of PCOS. And suppose if there is a young girl with a irregular cycle, that is less than 21 days and more than 40 days, and she does not have any unwanted hair or acne, that is when we need to look for any biochemical or the blood levels of the androgen, that is the testosterone levels. Dr. Sushma is going to talk about it in a little while. So that is how we have a very specific criteria for PCOS diagnosis in young girls. To give a big relief to a lot of parents, the ultrasound scan showing polycystic ovarian morphology is not diagnostic in adolescents. So in teenagers, suppose you take the child for a pain abdomen or some kidney stone or anything, and you do a scan and suddenly the pop-ups of polycystic ovaries are polycystic, could be PCOS. No, we do not consider the ultrasound diagnosis in adolescents. So please don't get worried. If there are young parents who are sitting with teenager girls, don't worry with a scan diagnosis. It is not used in adolescents. It is used only in adults. Okay, so we have very few specific criteria. And as rightly Madam told, this kind of problem can origin from the child during the mother's pregnancy and the childbirth also. If the mother was PCOS, if there was a gestational diabetes, if the baby was a preterm baby or a IUG or a small for gestational baby, these girls could be having a risk of PCOS. Now, I just want to ask you, Priyanka, now you are a dietitian sitting and practicing, giving nutritional advice to a lot of people. Do you see young girls, that is adolescents, are the parents dragging the adolescents for weight loss or diet counseling? Do you think the obesity is increasing because you're practicing from 6-7 years?
Yes.
Or do you think it is increasing?
Yes, ma'am. Yes, ma'am, quietly, because the lifestyle factors and the diet matters. They don't have inappropriate exercises. Their activity level will be very low, and the food they eat, the diet contains no good fiber, healthy fats, nothing. They'll be popping up on junk foods because that is the one which gives instant energy to them. And the parents will be thinking like that is the thing. Okay, if they are asking something, they'll be ready to give anything, but they are not concentrating on the healthy meal plate what they are eating. And then when they come back to me, the patients, like kids, they'll not have self-esteem. They'll be depressed. They're not ready to show themselves, and they're not ready to open up. They'll not have that self-esteem in them. They would have lost that because of the obesity. So I would counsel patients like what kind of foods to be eaten, and I would track the patients with good meal plate, and the diet should contain mainly for PCOS patients, the diet should contain a healthy fat, antioxidants, and a good fiber in them. This is what I counsel.
Okay, so you mean you told the obese girls or obese even boys who come for diet counseling, it is increasing day by day thanks to the bad cooking habits and thanks to the bad lifestyle and eating habits from the family, the whole family as a unit. And then have you observed any specific eating disorders like,
binge eaters.
Ah.
They'll be
So
eating more, but they're not physically active. They're not
what is binge eating, Priyanka?
like junk foods, ma'am. Junk food. They want to eat and eat. That's all. They require more calories. That too with no energy levels. They'll be eating like what do I say? Like more of outside food ordering. Now, though in Bangalore, they order more junk foods which contains bad fat, bad oils which are they are using it. They are eating more, ma'am. This is what I can.
So eating disorders, I'm sure even Ramya will agree, along with other mental health disorders, eating disorders are very common. It's in general population, it's around 1 to 3%, whereas in women or in women with PCOS, it's observed almost up to 20%. In almost 80% of women with PCOS, at least one eating disorder is observed. So when we really probe into their dietary habits as a part of counseling, we see that almost up to one eating disorder is present, observed in almost 80% of women with PCOS. The commonest being binge eating. Binge eating is that there is no satiety factor, there is no stopping them. They go on eating the high calorie junk food stuff. They go on filling up, and then there is no guilt about it. That's called binge eating. Proud to be a foodie and all that. And there are other disorders like bulimia nervosa where they eat and then they have guilt, so they induce vomiting, so they vomit out. Now there is something called anorexia nervosa where they suddenly, they stop eating everything because they want to lose weight. So there is a psychological component also for that eating disorders. Vinay, now I just want to ask you, now you are with, he's a very good physiotherapist, sports physiotherapist and sports rehab and all that. Along with that, I see in his clinic that there are a lot of these obese people, young people, both boys and girls. And when they come to weight loss, I'm sure they go to dietitian, they come to you. What difference do you see in their muscle tone? What difference do you see? Do you think it has increased? Or do you see what is their endurance? Do you find anything abnormal in the teenagers of today? Please unmute, Vinay, please unmute yourself.
Yeah, thank you, ma'am, for giving the opportunity. And yes, nowadays when I see teenagers or adolescents, they come up with too much of stress, and they come up with too much of workload on them, or whether they're studying or whether they're working. So they are not able to cope up with their day-to-day activities, or we can say planned activities. So, and they are not up with proper exercise regime where they can follow and they can judge themselves, or they can show themselves that what they can do. So that is what the main problem is. They are not aware about the particular program or that can help them to maintain their fitness level. And mostly when they come to us, they come in a hurry, like they want to get fit because they have particular condition. But their awareness regarding the fitness program is very less. So with respect to their muscle tone, or they are not aware of these things, that yes, their quality of muscles, they play a very important role in insulin sensitivity. They are not aware that the fat that they are having is too much, or they are aware of this thing only, yes, they are obese. But how we help them is we give them proper program. We motivate them towards that particular program throughout the program, okay? And we help them engage in that particular activity, what we have planned for them. Because if they are consistent, then only they can get all the muscle tone. Then they are consistent, they can maintain themselves.
Correct.
So they should not get disheartened during some days of program that they are not getting result. Only the thing is, there should be proper awareness toward exercise program, that how they can help themselves and how their positive attitude toward exercise can help them.
Yeah, so I agree with you. So what you mean to say is that youngsters are not aware of the fitness part of it. They just feel, okay, now I need to lose 5 kgs, so I'll go to the dietitian and take a chart. I'll go to the physiotherapist or the gym and lose weight. They're not really focusing on the long-term benefits or how to maintain the muscle tone or increase the muscle tone. And you used a very good term called insulin sensitivity. Insulin resistance is a condition in which the body has to secrete a lot of insulin to maintain the normal blood sugars. So the body goes on secreting so much of insulin that is from the pancreas. Along with that, the obesity increases, the abdominal fat increases. The fat around the tummy or the abdomen is the metabolically active fat or the bad fat. Okay, so that increases. So maintaining the tone, losing the weight in the around the abdomen, maintaining those muscle tones or the resting muscle tone will help improving insulin sensitivity. And in PCOS, almost up to 80-90% of obese PCOS have insulin resistance. And also there are these young girls who are adolescents and who have PCOS, but then who are not fat. But still they need to exercise because insulin resistance is present in them, it's present in almost around 60%. So in obesity, it's around 90%. In lean PCOS, it's around 60%. So even the girl, even if she is in the ideal weight, she needs to lose a lot of weight. She needs to tone the muscle. She needs to improve the muscle, that is a resistance exercise she needs to do so that the insulin sensitivity comes down. Now, in the same context, Ramya, how often you see young girls with psychological disorders like, eating disorders, sleep disturbances, emotional disturbances? Do you think that is increasing, and do you think that has got any connection with the PCOS? What is your observation in that, ma? Unmute, ma, please unmute.
Hi everyone. Thanks, ma'am, for giving me this opportunity. We very often see adolescents with psychological issues, ma'am, and especially when it comes to PCOS, there are 3 times more vulnerable, or they are 3 times more. They have this psychological issues when compared to normal group of people. So when it comes to psychological issues, what these adolescents in the age group of 10 to 17 or 15, so the early adolescence, what we see, this is a age where their actually personality is going to evolve. So they have lot of confusions about their personality, about their body. First they have to understand about their body and the changes happening in the body. So firstly, their emotions, their thoughts, that going to first have a lot of impact. On top of it, when they have these kind of symptoms of PCOS, what we see, the hair growth or the body image, all those things. Though you guys also spoke about the eat disorder, that is also one of the link here, which I would like to say, to overcome or to mask the underlying problem or the guilt what they face in the society. So they start eating just to, like, they have this high calorie or salt diet or fried items. To undermask these, they start doing this binge pattern or whatever the patterns Miss Priyanka was explaining. So other psychological issues we see is, ma'am, emotional disorders like depression, anxiety, and eating disorder. And when we see the behavioral part, we sometimes also see this conduct disorders, which is also related to, in critical cases, we see into criminal activities or behaviors or risk factors. So these are the few psychological issues what we see. And you were asking about the sleep also. So how it is related to sleep? All these kind of psychological issues are related to sleep. One, the physical changes happening in the body, and second thing is the psychological issues. So both of these connected, they have lot of sleep issues. Again, we call it as OSA. And one more thing in that, we also see the types of sleep issues. So one, they have difficulty in breathing in the upper layer of the body, and all of a sudden it restarts, and sometimes they feel this palpitation. So there are varieties of 2 or 3 types of disturbances happening in the sleep. So when I told about emotional things which is interrupting their sleep, is like, that is emotional disorders, either anxiety, where we can see panic attacks, fears of something, and what would happen to them, the fear of future well-being related to their personality development. All these things will disturb their sleep, where we can correct it. We can counsel them through, like, few of the sleep hygiene techniques, not only the physical medication and quality of life what we counsel them. Along with that, we also try to give them a skill like doing a proper sleep hygiene technique following. So these are the things what we will be working with them, ma'am.
Yeah, I mean, I agree with whatever you told. So, basically, PCOS, I'm sure Dr. Sushma will agree that there is no one cause for PCOS. Like, malaria is caused by, it is
Mosquitoes.
transmitted by mosquitoes. Dengue is caused by this virus. There is no one specific cause for PCOS. It is multifactorial, very complex, but very common endocrine disorder. And there are a lot of mimicking disorders. I'm sure Dr. Sushma will agree that, we can't jump at a diagnosis of PCOS. It is the kind of diagnosis by exclusion. So once a young girl comes to you, Dr. Sushma, she's around 15 years and she's having irregular cycle, and sometimes the bleeding is very heavy, sometimes the bleeding is very less, and she's growing unwanted hair on the face, and she's getting conscious, and she's putting on weight. So once she comes to you, will you immediately say she is PCOS, or will you want to rule out other conditions? So what are blood tests will you do in such a case to exclude the other common problems, at the same time also, if necessary, to confirm PCOS?
So I think that's a very practical question that we face on a clinical problem. And if you remember, madam, I think one of the cases we had, I think, about months back, and this was exactly a similar case as you said, 15-year-old with on and off, irregular cycles. In fact, she was staying abroad, if I may mention Kuwait, and she was, invested and always labeled as PCOS. And, then as you see the diagnosis of excision, the treatment to offer is probably much from the clinician side. It's all put on the family that you have to change your lifestyle. But the family is so lucky, they came back again and met you. And when you investigate, it was a completely different diagnosis. So I think that's a very important question. Anybody with menstrual irregularity or just gaining weight as PCOS, it is a diagnosis which we make after excluding many other hormonal dysfunction. I think the common ones which we could probably discuss at this forum is definitely a thyroid dysfunction, because that is quite common in the population and they can present similarly. And then, of course, there are some other conditions which are related to hormones. So as we are doing here also, we are looking at increased production of male hormone. But we have certain conditions which begin very early onset in life because of certain gene problems where, the hormone is produced, and that also presents in a teenager as menstrual irregularity and increased, hair growth. So this is something which we call as adrenal dysfunction. So that is one of the main criteria for us to before diagnosis PCOS. Sometimes there can be increased production of steroid hormone. I think most people are aware about steroid application, which is taken for various reasons. So that itself sometimes, if it is produced in excess by the body, or if it is given in excess inadvertently by the patient or by the other doctors, also can produce a similar picture. So I think there are some 4-5 main hormonal conditions which can present early. So I think our main objective of lab evaluation is to rule out these conditions. Then, of course, once we kind of know what we are ruling out and we have a strong clinical suspicion of PCOS, we do other lab tests to confirm PCOS and also to look at complications or the other disorders which are associated with PCOS. So I think, a blood test which looks at our blood sugar levels, the blood sugar control over a few months, a cholesterol or a lipid test. So these are all part of the spectrum which is associated with PCOS. A blood pressure examination, of course, when a young girl comes with obesity and menstrual irregularity. Then, of course, there are specialized hormonal tests, which one is to rule out the other conditions which I already mentioned. Then, of course, to confirm the diagnosis of PCOS, we look at the male hormone levels in the blood, so that we get whether we are confirming the PCOS as a diagnosis before we start the treatment. So I think these are the few lab tests which we look at. And of course, also ultrasound may not be very useful to confirm PCOS, but sometimes we do it to rule out other conditions which can make the similar presentation of abnormal periods. I hope I was audible. Network is a problem.
You are audible. So very beautifully you explained the clinical workup of a young girl. So parents bring a young girl of 16 years and then she's got irregular cycles. And then somewhere they have done the scan and then it shows PCOS, so they're worried. So in such a case, now we know we don't jump at diagnosing PCOS because, as I told you, it is a label, it is an enduring diagnosis. We don't want to create stress to the family. So at the same time, we examine the patient along with the hormonal signs like unwanted hair and acne and hair loss. We are looking at the height of the patient, weight of the patient, abdominal circumference of the patient, and the hip circumference of the patient. And also we are looking at the blood pressure. You will be surprised why the doctors are measuring blood pressure at 15 years and 16 years of age. Which girls will get high BP? In when you go with the irregular periods, doctor is examining taking the measurements. She is examining the blood pressure because, as Dr. Sushma told, the metabolic complications are not at all uncommon. Abnormal lipids or high cholesterol is present in up to 70% of women with PCOS. If there is a young girl with obesity and almost 3-4 years of irregular cycle, and she is around 80-90 kgs for a 5-feet-old girl, and if there is a very strong family history of diabetes and hypertension, she could be a high risk for metabolic complications. In my practice, I have seen young girls as young as 18, 19 having high BP, high cholesterol, and insulin resistance or glucose intolerance. Their sugars are abnormal. So it becomes our duty to examine the patient, examine the young girl. Apart from looking at the hormonal changes, we are going to look at all these metabolic parameters like the obesity and BP. And then once we finish the examination, we order some simple blood tests. That is a thyroid hormone test. There is a hormone called prolactin hormone test, which is secreted by the pituitary glands. It is not at all uncommon. High prolactins can cause irregular cycles. So if there is a prolactinoma or if there is a tumor in the pituitary, sometimes we do ask for a MRI brain. There's so many parents get tensed up, we are going with irregular cycle and doctor is asking for a MRI of the brain. That is to find if there is any pituitary adenoma or a benign tumor. But don't worry, even if it is there, the treatment is medical. We give hormone, we give medicines to reduce the prolactin. That also is not a uncommon diagnosis at all. We do find monthly 2-3 patients with hyperprolactinemia. Along with that, as Madam told, excess steroids or Cushing syndrome, adrenal disorders, all these disorders, we rule out all the disorders. And once this diagnosis of PCOS is made, now there is a 16-year-old girl with a diagnosis of PCOS. Now, how exactly should we treat Sushma? What exactly, now you imagine that there is a couple, there is a parents and the girl is sitting with the diagnosis of PCOS. Now, how do you go about? How do you advise them? You have examined, you have diagnosed. How do you manage them?
So I think as we discussed, it is a disorder. So most I know the parents want to, because of certain means, or is it from, other, or is it because of the lifestyle that we are looking at? So this is one of the typical disorders where it is multifactorial. So it starts in utero, definitely. But definitely it's also influenced by our environment, the way we, the way we have been fed during our infancy, during our childhood, during the adolescence, what kind of lifestyle we are looking at. So we have to try and catch the triggers by a complete detailed history and, examination. And then, of course, basically what we look at is definitely a change in the present lifestyle. So most often, most of these children, I think in 97 to 98% of cases, definitely there are certain, lifestyle factors which has contributed to or pushed this, child into this situation, irrespective of the genetic, influence. So genetic, of course, we tell them, it's not in our control as of now, but the environment is what we can, change. And the environment, when we look at environment, I think as already discussed, it's mainly about the nutrition and the physical activity. So very important to start counseling them and talking to them about changing the lifestyle. So a good nutrition counseling and, trying to pinpoint the, the negative points in their lifestyle would go a long way in helping them. and of course physical activity. I think most of us agree, and in fact it's so shocking that physical activity these days has to be prescribed, because even if you tell me, but where is the time for this? So sadly, it's something which cannot be prescribed on a paper. It has to be done by the child, and of course by the family, making the resources available for the child. So I think a good physical activity anywhere between 1 to 2 hours, depending on the, of course, the age of the child. Vigorous physical activity is very important, and also important to start slow, because some of these adolescents are not even used to physical activity. So to begin with a few minutes per day, 10 minutes, break it up into 3 times, and then slowly build up on it. So that I think would be the most important aspect of management. And of course, we have our support team, where we have a good nutritionist and physiotherapist who will guide them to take this forward. So this is the main treatment, I would say. Definitely, then we look at what symptom is bothering, primarily the cosmetic or the hair growth problem, or is it a menstrual irregularity, or is it the obesity, the cholesterol. So then definitely, depending on what symptom is the problem present situation, which is being presented, accordingly definitely we need to treat that too. So that will be specific for the condition.
Correct, you are totally right, because lifestyle modification is the mainstay for management of PCOS, whether it is in adolescents or in adults. Lifestyle modification includes 4 components. One is the physical activity or exercise. Second is the diet. Third is the sleep, and fourth is the reducing stress. Okay, so it contains 4 components. So we need to address this or rectify this, or to know whether this girl's lifestyle is bad. So we need to understand her lifestyle. So we need to give her a chart, what time she sleeps, what time she gets up. If she's sitting with a smartphone till 1 o'clock, 2 o'clock in the night, and wakes up at 10 or 11 o'clock, that is bad. So we need to make sure early to bed, early to rise. And then we need to ask her how often she eats junk food, and what is the cooking method in the family, and exercise, how often she does, how often she walks or does the household work. So all those questions we need to ask, and then we have to advise. So whenever we are giving any advice about the lifestyle modification, mind you, this has to be followed not only for only 3 months or 6 months. Once a PCOS is there, it is going to stay with you till your menopause. Okay, so till your menopause, it is going to stay. So this lifestyle modification has to be throughout your life. So in that context, we can't tell 100 kg a girl weighing 100 kg, you lose 40 kgs in 3 months and come. She will never come back to you, because it is very, very impractical. So we need to be with them, at least give them at least for 3 months to 6 months, guide them for a lifestyle. Once they see the benefit themselves, they will adopt to the new lifestyle. So in that context, Vinay, you have handled our patients with PCOS, that is particularly the adolescents. And how do you, what exactly do you advise? And everyone can't go to the gym. Every day they can't go to the gym, or, everyone. So like, what are the different activities girls can do to make sure that they are having a good physical activity?
So when a patient comes to us with a particular condition, so here as PCOS, we assess them thoroughly and we plan a structured program as per their need, as per their body requirement, as per the assessment that tells us, yes, okay, this much of walking is good for that particular adolescent. Okay, so as per proper way, we should at least walk for 150 minutes in a week. So we can divide that 150 minutes in 5 days, so they can give 25 minutes at least a day of walking. They can walk with their family members to make it more interesting. They will spend time with their family members. So the program, what we plan, is very interesting, is very engaging, and we help them throughout the program in such a way that every component of fitness is managed, like their flexibility level, their mobility level, their strength level. And for 25 minutes of walking, there is a need of muscle strength also. Correct. Muscle strength plays very important role. So if a person is doing only walking, it will not serve the purpose. So here the purpose is to make them very fit. And that will happen. That will not happen in a day or two. That happens over a period of time. So the program what we give is properly structured as per the individual need, and as per the, and it should be engaging in the form like various activities, aerobic activities, like not only walking, like they can dance or they can go for a swimming. So there are various other activities, aerobic activities they can do. They enjoy what they enjoy. We should use those things only into their program. So then only they get themselves engaged for a longer duration of time, and we get good result.
Absolutely, absolutely. Because you told the girls have to enjoy what they're doing. You know, you can't expect a teenager of 16, 17 years to go on walking every day. She may feel bored sometimes. So engage her in dancing. They can dance at home. They can look at the YouTube and dance at home. They can do aerobics. They can do swimming. They can get into any sports. Apart from that, see what Dr. Vinay told is that 30 minutes of this aerobic activity is important. Apart from that, you finish your gym and then you come and sit off in the couch is not enough. Throughout the day, you need to be active. You need to make sure that you keep walking in the house or near the college. Take a bus stay. When you take a bus stop, you get down one bus stop before. Walk to the college. Even in the school or the college, keep walking. You know, walking up down the stairs and start doing your household work like cleaning your own room. Don't expect your mom or maids to do that. So this kind of activity throughout the day is extremely important apart from the 30 minutes dedicated brisk walking or the aerobic activity. Along with that, Vinay stressed on building the muscle strength or the resistance exercise because a resting muscle tone, if it is increased, the insulin sensitivity improves, the chances of diabetes and, glucose intolerance will come down. So make sure that, you do this endurance or the dumbbell. And there are a lot of this active endurance and then passive endurance exercise. I think your physiotherapist will tell you. So make sure that you get, apart from the duration of the exercise, you need to build your muscles, and this has to be lifelong. Being active has to happen lifelong. Thanks, Vinay, for that. And Priyanka, now when the young girl comes to you with the parents, I'm sure most often the woman or the mom is the one who cooks, or if there is a maid. We have seen in urban Bangalore, a lot of people, while the woman is working, they are getting food all 3 times. They are getting food from outside lifelong, all 365 days a year. So that is not good. So can you stress on how do you give the dietary advice? And also, you have to be very general because the dietary preferences across India is very, very different. And second thing, what about the cooking habits? How they cook? Does it matter?
Yes, ma'am. Yes, either they'll be using more oil or any, like they want instant cook is more important for them because quick, they want the time to be spent very less because of the hectic schedule. I make sure I plan a diet according to their preferences, and I will never eliminate what they are using suddenly, because most of them end up having withdrawal syndrome. So
Correct.
that too, children with that age, they really restrict not to eat the food which I tell suddenly. So I never eliminate anything. I make sure they eat very occasionally what they were eating before, and put some nice healthy diet in there. And I make sure share good recipes to them so that their time can be easily spent with that. And their water intake will be very less with these kids. I tell them to keep themselves hydrated, and their sleep also will be very disturbed. It will not be in a very good pattern, and their stress level. I always tell these 3 things to manage very nicely and plan a diet according to their preferences.
Yeah. So when it comes to, as Priyanka very rightly told, we can't tell a 18-year-old or a 15-year-old child, don't eat sweets. Lifelong, you're not eating sweets. Don't eat ice creams. And that doesn't work because they'll hate you for that. For that
Yes.
matter, even we can't stop eating sweets or ice cream, isn't it? So
Yes.
what I tell in PCOS, many kinds of diets have been tried all over the world. There is no specific PCOS diet. There is nothing like, okay, you eat these things, so PCOS will get controlled. You eat these things, PCOS will become worse. There is no specific PCOS diet. But general guidelines is that one thing, you have to eat fresh. You have to eat every 2 to 3 hours. Include a lot of fibers like vegetables and
Yes.
fruit. And even if you are eating non-veg, you can have lean meat. Avoid red meat, deeply roasted, fried, marinated stuff you need to avoid. And all the junk food, we know all the junk food, so you need to avoid. Don't stop. You avoid. And one simple rule, what I have found to motivate the young parents and the young adolescents is that whatever she is eating, you cut down 30%. So give a 30% discount. If you are eating gobi manchuri monthly 3 times, make it monthly once. If you are eating weekly 3 times ice cream, make it once. If you are eating 4 idli, make it 3. So, that satisfaction that, okay, fine, I can eat ice cream. She may not eat, but still, no, I can eat ice cream because the other doctor told no need to eat, stop eating chocolate. So you can eat everything you eat, but you reduce by 30%. So obviously, initial first few days, you feel very hungry. So you substitute with high fiber vegetables like cucumber or tomato and carrots and, radish and all that. So that will give the satiety. And once that becomes a habit, because they are enjoying everything, they'll start choosing their food. And few lines about the cooking habits, Priyanka. I'm sure you agree with me. How they cook, how the food is cooked is very important. So avoid Teflon coated non-stick tawas. You avoid the plastics, freezing the food and pulling it out and reheating in the microwave. That also contains a lot of toxins, which is increased in PCOS. So make sure, you use steel vessels or copper vessels or steel vessels, cook fresh and avoid too much of dairy products, eating cheese, butter, because even the milk also can contain some hormones thanks to the malpractice. So they avoid too much of dairy products. But then, as Sushma will agree, adolescents need milk, isn't it? Because it contains a lot of calcium. So the cooking habits. So we need to educate the mother. And also, we need to educate the fathers because sometimes when the mother has put the girl on the diet, the fathers will secretly bring and give something. So we need to educate the fathers also about it. And as Priyanka told rightly, very important is the sleep. And coming to the counseling of these adolescent young girls, because the under-addressed complications is mental health complications. Sushma, in our clinic, we do a mental health assessment called primary health questionnaire 9. We ask 9 questions. In adolescents, we take the consent of the parents because they are minors. So we take the consent of the parents and ask every girl in very simple local language about how they feel about their mental health. You'll be surprised and shocked to see that almost 90% of women with PCOS undergo depression, almost 80% undergo with anxiety, and around 20% have psychosexual disorders, 20% have binge eating or eating disorders. So I'm sure because Ramya works with me, she has sent so many young girls with their parents for counseling. And the fact that you start talking, there is so much of sadness in them. There is so much of body image issues, the way they look and all that. Ramya, how do you counsel these parents or, about these phobias, about this body image issue and about the anxiety, depression? How do you counsel the family?
First, when the individual come to us, ma'am, we do screening. Screening is where we talk to them, we try to reach the etiology of the problem. Then we give them certain scales. Once we get the diagnosis done, so we use certain scales. Like for the depression, what we are currently using the PHQ-9. For other one is that Beck depression scale, or for it is an anxiety HAM-A. The HAM-A we use it. So for if ever it is an eating disorder, so when we have to involve the family, there is something called as Maudsley's approach. So we use that for the family session. So first we will try to screen the patient, take the history from them, make the diagnosis, treatment plan, and then we will go to the family members, ma'am. Parents, we do something called as psychoeducation. First, we will try to explain the parent about the problem. So sometimes, like, even they may be anxious, like because of the age criteria. So we need to do psychoeducation, and then we give them the treatment plan. Then how they have to follow that, how, because they are the support system for the girl. So how they will have to be mentally strong, what are the emotional disturbances what she'll be going through, how they have to support them. All these things we will be doing in a splitted sessions, not the single session. So initially we take it up from history taking, first screening, history taking, then making the diagnosis, then we will educate the family members, and then plan the further sessions, ma'am.
Yeah.
So we do educate the parents also, because they are the main support system.
Yeah. So like basically these young girls with a lot of acne and unwanted hair and obese and eating disorders and less sleep, and being body shamed by the classmates and friends, and feeling lonely. So they need to be addressed. There is no shame in going for a psychological counseling or a therapy. Sometimes very severe depression, we need antidepressant therapy also. There's nothing, no shying away. That is a temporary thing. Exercise and weight loss and diet, and sometimes the therapy also, that is, therapy means the pharmacotherapy or the medicines can reduce the depression and the anxiety. Don't worry, they're not stuck with a depression lifelong. Okay, once they lose around a little bit of 5 to 10% of body weight loss, can reverse all the metabolic problems. So, Sushma, sometimes, as you told, lifestyle modification, that is, as Vinay, Priyanka, and Ramya have educated. So, exercise, diet, and good sleep, and counseling, and keeping oneself fit, doing yoga every day. That yoga will address both the physical fitness and the mental health. Sometimes you will be bound to give these hormonal medications in adolescents. That is, a combined oral pills we give, and also metformin we use in adolescents. So, in your practice, how often you use them, and in whom do you use them?
Yes, so I think as we already discussed, lifestyle modification is the state of trend. Symptoms which is
we can't hear you well, sir.
Support symptoms. Unless we support them, so unless we support them during the present symptom, the positive feedback is lost. So the the young girl is mainly concerned about the hair growth or the menstrual irregularity. So it's very important we address the present symptom, so that the modification of that itself brings in positive reinforcement, and the child is motivated to continue the lifestyle changes. So am I audible?
Yeah, you are audible very much. Yeah, carry on.
So when we have a situation where there is, so when we have a situation where there is both menstrual irregularity and abnormal hair growth, so definitely we look at what is the first line of treatment, which is usually a contraceptive pill, which is a combination of both. So it also helps us regularize the menstrual cycle and also helps to reduce hormone, which we already discussed, and this brings about improvement in the facial hair. So that itself, gives a good feeling to the young girl. And also it's important to know, because many parents are very worried when we start writing pills. So they are definitely concerned about the short term and the long term consequences. So what is important to know is this is all going to be short term till we kind of regularize the hormonal disturbance which has happened. So we give a short course for 3 to 6 months, then stop the treatment, reassess them, and then only go forward. So that is the, I think, main indication for hormonal treatment when we have menstrual irregularity and of course hirsutism, which is abnormal hair growth.
Correct. Yeah. So I totally agree. So as Dr. Sushma told initially only, we need to treat the patient for which they have come. Suppose there is a young girl of 15, 16 years and unwanted hair on the face. I can't be talking about diabetes and insulin resistance. She'll get bored and she'll change the doctor and go to one more a dermatologist or a cosmetologist. So we need to assess, diagnose, and we need to treat what they have come with, what exactly is bothering them. So this direct hair removal methods like electrolysis, laser therapy, plucking, waxing, shaving, bleaching, anything they can do, because that is the one which is causing a lot of distress, as Sushma rightly pointed it out. If the hair stops growing, or if the hair becomes a little thinner, and if hair grows slow, then she will automatically feel better, and about her own body image, and the depression will come down, anxiety will come down, and she'll be more motivated to do the exercise and the diet and all that. So we can always recommend the patient to go to a dermatologist and go for any kind of direct hair removal methods, depending on the affordability. Lasers are the primary, most effective ones, but then they are costly. So even inexpensive methods like bleaching or shaving or plucking, waxing also is okay, as long as it gives relief to the primary symptom. That is one thing. And as Madam told, combined oral pills are commonly prescribed when the lifestyle does not work. And in very obese, suppose there is obesity is very increasing in adolescents. 5 to 10% of adolescent girls are obese. In obese girl, or if there is a little high BP, or if there is a little cholesterol is high, or if the sugar is borderline, then we give a tablet called metformin. This can be very distressing to the parents because, metformin is given in diabetes. For all their grandparents could be taking the tablet. Why this patient is, why my daughter is given metformin, which is a sugar tablet, they are very worried. But then as clinicians, I'm sure Sushma will agree, we tell them, we explain to them that, it reduces insulin and this is temporary. 5 to 10% weight loss is what we need. So you lose around 10% of your weight. It is 70 kgs should lose 7 kgs, 60 kgs should lose 6 kgs. And that is a very simple and smart, we call something called SMART goals. That is simple and it has to be measurable. No, that is we measure the weight and then it has to be achievable. You can't tell lose 30 kgs in 3 months. So it has to be something very achievable, small goals, and it has to be and time bound. You can't tell lose 10 kgs, come back after whenever you want. We can't tell. So we tell, okay, lose 5 kgs in 6 months. Okay, then calling them again and again helps a lot. I'm sure you agree, Sushma. Calling them for reviews and reassessing. We need to reassess the psychological aspect. Every time we need to check the exercise every time, and we need to check the diet every time. It can be little stressful and enduring to the patients and the family and even the doctors. But then PCOS itself is a very complex disease. And then as you see in the panel, there are a lot of doctors. There is a gynecologist, there is a endocrinologist, there is a fitness expert, psychologist, a dietitian and nutrition expert. So it is a multidisciplinary approach is very much essential. So I thank all of you for joining this panel discussion, all the experts. I want one closing comment from all the experts who are here with us. Sushma, can you start? Just one closing comment for all the adolescents out there and the parents who are watching this video.
Yeah, I think if we are there, it's nice to tell them that you are not alone, any like you, and it's definitely.
Can you please repeat? It is not heard well. I think you can stop the video and do it. I think that's better, Sushma, please.
Oh, okay,
Yeah.
okay.
Please repeat.
So yeah, I think what I would like to tell the audience is, because all of them are very concerned, is it only us? So I think after this presentation, it's clear that it is common. It's not only you. There are many like you, and very important, it's treatable.
Thank you. Vinay, any closing comments?
Yes, it is very important for adolescents with PCOS to focus on balanced diet, stress management, and adequate sleep. And before starting any health or fitness program, they do consult their health expert first and a physiotherapist or a certified fitness trainer so that they can get adequate knowledge regarding the program and they can prevent themselves with injuries and they carry on the progress for longer duration of time. So that is very much important to go to the right person and follow the program strictly and adapt it for longer duration of time.
Fantastic. Yeah. Priyanka.
Always eat healthy. Don't Google, be fit and be positive.
Yeah. Fantastic. Ramya.
So please track your thoughts and whatever you're feeling, please be expressive. Sit and discuss with your parents. Please don't take any negative decisions or any kind of thoughts you feel it is disturbing you. Kindly sit and approach anybody for that matter for just 5 minutes.
Fantastic. Yeah, as Ramya pointed out, the most important message, the adolescents need, feeling depressed or sad or anxiety, and sometimes suicidal ideation can be seen in PCOS. Don't think that it is because only you are suffering, and it is because of how you look. It is because of the hormones which are playing havoc in your body that is causing. So there is treatment for that, losing weight and getting a healthy lifestyle and seeing all the doctors, and that is certified fitness and discussing with family, going for a therapy. Everything will help you all in the long run. So make sure that all of you recognize your symptoms, share it with your family, come to the doctors, don't shy away. And whatever lifestyle management you do, changes you do, it has to be long term. So you need to motivate yourself and make sure that you are fit for a long time in your life. Thank you so much, Priyanka. Dr. Priyanka, over to you.
Yes, ma'am. Yes. So we have come towards the end of today's panel discussion, and I must say that it was a very comprehensive discussion. We covered almost all the important aspects towards the PCOS and adolescents, like diagnosis, risk factor, dietary factors, eating aspects, fitness aspects, psychological aspects. So I'm pretty sure that it's going to be very beneficial for all the adolescents who are suffering from PCOS and their parents as well. So thank you, all the panelists, Dr. Chandrika Anand ma'am, Dr. Sushma Rai ma'am, Dr. Vinay Choudhary, Ms. Ramya, Ms. Priyanka. Thank you so much for giving us your valuable time and sharing your knowledge with us. And thank you everyone who has joined for today's panel discussion. Also, many thanks to Dr. Durusha ma'am, Dr. Shobhana Patel, and Ms. Ruby Sound ma'am. With the efforts of PCOS Society of India, this panel discussion has been brought to you, and it's been supported by Philips. Also, if you have any questions, you can always email us on manager.vijeta.pcos@gmail.com. Thank you, everyone. Thank you. We can end today's panel discussion.